Hope everyone's had a great conference so far. Thank you for joining me on Wednesday afternoon or Wednesday morning. My name is Louis Gomez. I'm the Chief Technical Architect at Optimum Healthcare IT. My background is, I've been working in the ServiceNow space for 11 plus years. All of it's been in healthcare. Prior to working on ServiceNow, I worked on Epic, the electronic medical record, certified in a handful of different modules there on the inpatient side. And then I also come from the clinician space, working in the emergency department for a good number of years. So let's talk about who Optimum really is, right? So we have highly decorated, a lot of awards, and something we need to add to this that was just announced this week was Class Overall Implementation Service for 2026. But we have a few different services, right? So we have our enterprise application services, so our Epic implementations, our advisory, staff augmentations, go live support. We have our digital transformation practice as well. This is where our cloud practice comes in. Our ServiceNow, which is primarily what I'm going to be talking to you about today. And then, of course, our workforce management, our resource alignment, and staff augmentation. So our ServiceNow practice, again, a lot of awards on here. We were awarded Healthcare Partner of the Year by ServiceNow last year. Keep your eyes out for the next Healthcare Partner of the Year that should be coming out in a press release soon. We have the most amount of validated practices than any other ServiceNow partner out there in this space. All we do is healthcare. And so this is an area in an industry that we're very passionate about and we know very well. In previous years, I've been on stage and I've talked about some of our innovative accelerators. So we have accelerators around clinical device management, HR vitals, even ITSM, SPM. So some of your really popular modules that you have in your ServiceNow area, how do you get quick value fast, right? Whether you're live with one of these modules and you're not getting the value that you're looking for, you're looking to add on one of these modules, right? We have a very prescriptive way on how your peers and other hospitals are getting value out of their ServiceNow instance. Today, I'm going to talk a little bit more about EMR Help, right? So this is a module that I'm sure most of you already have installed. And if you don't have EMR Help, this is one of the biggest value modules that we see in ServiceNow. So let's talk about what EMR Help is really quick. So real EMR Help becomes that front door to, for Epic support. It's built right into the clinician workflow. So your clinicians are clicking a button within Epic, automatically logs them in, right? And it's very simple. And we can do a lot of innovative things on this portal. But it doesn't stop here. That the same intelligence that we're using for EMR Help also carries into care team operations. So care team operations is something new that ServiceNow just announced. And it's really going to allow your clinicians to visualize what other clinicians have submitted, right? It reduces the number of duplicate incidents that are coming into your service desk. And this also plays really well into your Community Connect environments. So if you're looking to partner with another hospital, extend your Epic instance, right? We can use dynamic portals that adjust based on the user's organization or affiliation. So you can have your EMR Help for your internal folks, then also for your external or Community Connect members as well. So what I want to talk about today is, how do we then elevate your EMR Help implementation, right? So if you already have something in there, it might be working well, but now with AI, right? What kind of conference would this be if we didn't talk a little bit about AI? How can we elevate your EMR Help with AI? And there's some skills that I wanted to go over that we can build into your EMR Help. So the first one is, a dynamic intake form, right? So this is, I think when your clinicians are submitting an incident or submitting something broken, one of the things that we hear most often whenever things get submitted is, we don't have the right information that we need to fulfill this request. Or now your analysts are having to spend time waiting and trying to reach out to the clinician that originally submitted the incident because we don't have enough information. So what AI does in this case is we can read what the user is typing in as that initial issue, and then it's asking more clarifying questions, right? And this is going to be dynamic. This isn't a, building a whole bunch of questions and building a lot of if-else rules. This is really AI being able to read. You give it some prompting information, you give it the types of questions that the users needs to ask, then you feed it your knowledge articles as well, so they can then learn over time and ask the clarifying questions that are needed for the analyst to resolve the issue. Other thing I want to cover is some AI trending detection and major incident identification, something that's always scanning your incident table, your request table, trying to find some common trends and being able to recommend any problems or identification of a major incident. And then we'll also talk about some intelligent assignment and group routing. And if all of your incidents are going into a triage today for your service desk, that's a lot of man hours that your service desk is having to go through, read through these incidents, and then route it to the correct teams. So what makes this powerful is these AI capabilities, they're not a standalone tools, right? They're embedded directly within EMR Help. And when a clinician submits an issue from within Epic, the experience feels, it's simple, but behind the scenes, there's multiple skills that are running and working together. One of the most common breakdowns in EMR support is the misclassification of work. And what I mean by that is the enhancements. What's an enhancement? Meaning what's nice to have versus what is something that's truly broken within your environment, right? You're having to tell your clinicians when something's broken, you go here. When you want something, you go here. But there's always that gray area. The clinicians don't really have time to search for the right request. They're submitting everything as incidents. And then what that does is then your analysts are working off incidents. You end up with a lot of bad data. So with AI being able to detect whether something is truly broken or something is more of an enhancement, right? Again, with that dynamic form, we're asking the right questions based on incident, based on enhancement, and then on the background, it gets classified correctly, routed correctly. So what this slide represents is the intelligence intake. Make sure it's working there. There we go. So it is running. Instead of getting clinicians a long static form, we're using Now Assist to dynamically adjust the questions in real time. So as the user is typing in what the issue is, in real time, it's then giving them some subsequent questions that the clinician needs to answer. By structuring the intake this way, we collect the details right up front, right? So the workflow, impact, behavior, what the system automatically recommends to calculate the correct priority. It determines whether it's a true break-fix incident or this is enhancement request, and then it routes to the appropriate Epic teams immediately. The result is the fewer back and forth conversations between your analysts and your clinicians, better governance, cleaner data, faster resolution times. So this is becoming really helpful, especially during your high volume periods. What I mean by that is if you're going live with Epic, or even if you're going live with another system, let's take an ERP go live, or there's a merger or acquisition, any of your major go lives, we can essentially use this technology. This is not only for EMR Help, although I am kind of showing how we can elevate EMR Help, but we can put this into your normal portal as well. So any of your go lives that you have, we can use this information. These dynamic forms, it's really going to depend on the information you're feeding. So if I'm feeding it a lot of Epic tip sheets, then it's going to tailor all of the questions based on the content I'm feeding. But if I can also structure my content and my prompt to work for ERP go lives or any other go lives as well. So when a user submits an EMR help, right, the system doesn't just create that ticket. It analyzes the workflow, the context, and it compares it against curated Epic tip sheets or really any other tip sheets that you have within your environment. right? And these are typically created by your Epic training team. If the issue matches a known workflow question or common error, the AI presents recommended resolution steps instantly. So whether you store your Epic tip sheets in ServiceNow or you store them external into something like SharePoint or YouPerform, we can use AI, index that data, and then present that information here on the screen for the user to view and try these troubleshooting steps before they actually hit submit. The result is fewer unnecessary tickets, you get faster self-service resolution, and then we reinforce kind of the standard workflows, which ultimately improves your clinician experience. Every assignment adds delay. So as incidents are submitted, if it goes to your service desk, it sits there for a while. If it's misassigned, it sits there for a little bit longer, and it's just adding more and more of a delay. And every bounce between team increases that time to resolution. So with AI-powered assignment routing, we're shifting from that manual triage, to manual triage and static rules to more intelligent routing. The system evaluates the incident details, so the main description and those clarifying questions, and it also uses previous incidents that have been resolved. So it's going to continue to learn and grow over time. So we use predictive intelligence within your ServiceNow platform to view all of your previously resolved incidents, and it recognizes specific patterns that each team resolves on a regular basis. We also combine that with some of the knowledge articles that are built within ServiceNow to ensure that it's making a great decision with high confidence that it's going to send these incidents to the correct team. So with all of these skills, right, we've implemented this a couple of times, or a good number of times, with healthcare organizations that are going live with Epic and really improve the incident assignment and the incident data quality just by installing some of these new Now Assist skills. So traditionally, identifying systemic Epic issues depends on someone noticing a pattern. So it's multiple tickets with a similar symptoms or the same module, and connecting the dots manually, it takes time, and during that time, clinicians are disrupted and their disruption continues. With AI-driven incident trending, the system will continuously analyze all of the new incidents that are coming into the queue and recognize when it sees specific patterns or multiple incidents that are being submitted all for the same issue. It will then prompt you to either create a problem or create a major incident. And once that major incident is created, any newly submitted incidents from there are going to be automatically attached to that major incident. Once something is resolved, they all resolve at the same time. All the clinicians are notified at the same time. But this is an early detection of something that's possibly going wrong within your environment. So from a CIO perspective, right, this strengthens the governance and improves the visibility into the enterprise and stabilizes some of your common trends. From a CMIO, this perspective is about protecting the clinical workflow and the patient safety. So the skills that I'm talking about up here that I've mentioned are some custom skills that Optimum Healthcare IT has built and that we're providing in our implementation services. With Now Assist, you also get instant access to a lot of pre-built skills that are already available within the ServiceNow platform. So these skills reduce that manual work that your agents have to do by providing some case summarization, some resolution notes, being able to resolve requests or incidents faster because we have correct automatic routing. Leveraging some of these skills to improve the data quality is going to be very critical, right? Because the next step is preparing for the Now Assist. What are some of the things that I can do today to prepare my environment to work correctly, right? And that first one is that clean, structured data. So the first and most critical component, right, is the structured data. And the Now Assist and predictive intelligence learn from your historical tickets. So if you have closed notes that just say resolved, that's not giving the AI anything to use to be able to determine the questions that it should be asking from the user. It's not giving the AI any information on which team needs to resolve these incidents. Also, if your incidents are not classified correctly, if you're working enhancements or nice to have items out of your incidents and it's not following a proper workflow, that's also going to give you some bad data. It's going to feed the AI some bad information. If you're also using incidents to bounce from one team to the next for a multi-step workflow, it's also not going to be able to figure out what is the most appropriate team to resolve these incidents. So the first and foremost one is your clean, structured data. Second is your governance, right? Your priority definitions, your major incident definitions. It's going to allow you some cleaner triage, some ownership, and it really has to be documented and consistently applied within your environment. So AI can accelerate some of these decisions and not compensate for some unclear organizational standards. The third one is the predictive intelligence. So this improves over time as analysts this improves over time when analysts correct the routing decisions and reinforce some accurate outcomes. So this is something that you could turn on in your environment today, right? Have it run through all of your previously submitted incidents, and then you can run some test models through before you actually activate into production to see what the quality of your data currently looks like. And finally, it's the change management, right? Analysts need to understand that AI is more of an assistive tool. It recommends, but doesn't necessarily override what your analysts are typing into your environment. So AI in ServiceNow, right, it's really going to amplify the maturity of an existing process. So if your incident taxonomy or your structured governance is not well disciplined and your routing model is unclear, AI is just going to broadcast that or amplify those types of issues. From a CIO perspective, this is a scalable operational intelligence, and Now Assist kind of enables the smarter, faster triage. From a CMIO, right, we're trying to protect that clinical workflow, trying to make it easier for your clinicians to submit something through the portal. All right, guys, I have a couple of minutes left for questions. I'd love to show you kind of a live demo. So as soon as I'm done here, you can find me at booth 2202. And I'd love to be able to connect and chat a little bit more about your EMR Help implementation, your journey, and kind of whether you're looking at Now Assist and ServiceNow to help your clinicians. Yeah. Good question. So the question was, I mentioned that we've implemented this at a couple of different go lives. Are there some kind of actionable or some results that we've seen by implementing Now Assist for the Epic go live? What we did for this latest go live, and it just happened a few months ago, very large go live, we were measuring what the accuracy rate was when a user were to submit something through the portal and the user would select a service and service offering. What we found is the accuracy was less than 40% accurate. And then we also measured that against the service desk. What was the service desk accuracy if they manually routed these? And it was a little bit higher. It went up to about 60%. And then once we activated Now Assist to do the automatic routing, it then jumped to 80%. And that was just right out of the gate, right? So this is an Epic go live. There's not a lot of history to go through and see some of these incidents. So now, as they're continuing to keep their data clean, it's only going to get better and better and more accurate from there. Great question. All right, team, I think we're out of time. Please find me at 2202, and I'd love to connect and chat more.